I'm Alex Nelson. I'm a physical therapist at Optimal Physical Therapy at the Buffalo location. I am certified in dry needling, and today we're going to work on somebody's low back. To start off the process of dry needling, we'll first look at the patient's motion, see how they move, and then we will get into the actual process of needling itself. We'll clean the area, sanitize it with alcohol. We'll then insert the needle. You'll feel a little prick generally, and then insert the needle deeper into the muscle. This helps release the muscle. It gives it a specific stimulus and will release and relax the muscle. After we have completed the dry needling process, we will look at the patient's motion again after and compare it to before, and generally we see a good improvement of motion and in pain levels.